Colon cancer can be cured if it and precancerous polyps are caught early, but doctors at Mayo Clinic say only half of all people at risk of colon cancer get screened for the disease. That's because some people don't know they should be screened, and others simply don't want to undergo colonoscopy. But a new test developed at Mayo Clinic makes the screening process a whole lot easier. It's called virtual colonoscopy, or CT colonography.
I see CT colonography as a way of extending colorectal cancer screening to more and more people.
A way to save more lives.
And it is a fancy x-ray of the colon where we're able to visualize the lining of the colon to check for polyps.
Or fully developed colon cancer. Unlike traditional colonoscopy, which involves inserting a scope into your colon while you're under sedation, CT colonography is quick and non-invasive.
You can get your exam in the morning, go back to work later that morning.
Dr. Joel Fletcher says right now the bowel preparation for CT colonography is the same as for colonoscopy. You can only have liquids the day before, and you have to drink from 2 quarts to 1 gallon of this to clear out your system. But doctors are developing ways which will only require patients to take barium tablets and a small amount of liquid without changing their diet. The technology uses CT scans to create 2- and 3-dimensional maps of the inner surface of the colon and rectum.
And there's 2 ways that I look for polyps.
One is by using the 2D CT scan to look for narrowing and defects of the colon.
I can just correlate that very quickly with the 3D view.
That mass is a polyp and possibly a cancer. If cancer is found, patients will then have a traditional colonoscopy so doctors can take a biopsy. That test remains the standard for people at high risk, but for people at average or low risk, virtual colonoscopy may be an easier option. Dr. Fletcher says the test may get even easier in the future as it may be done with limited bowel prep. He also says CT colonography has proven to be just as effective as traditional colonoscopy at detecting most cancers. He says the technology will not replace scoping, but it will reduce the number of people who have to have the procedure. For Medical Edge, I'm Vivian Williams.